Is your headache a sign of an ischemic or hemorrhagic stroke? Imagine suddenly feeling a headache unlike any you've had before. It hits you fast and hard, making you wonder if something serious is happening. Headaches can be tricky because they come in many forms. Some are mild and dull, while others are intense and sudden. When it comes to strokes, understanding the difference in headache types can save lives. In an ischemic stroke, which happens when a blood clot blocks blood flow to part of the brain, headaches are less common. When they do occur, they tend to feel like pressure or aching, not throbbing. These headaches are often moderate to severe but might not be the first sign. They usually happen in the front part of the head and can last 4 days or even months after the stroke. Sometimes, they are linked to strokes affecting the back part of the brain, which has more nerves and can cause more pain. These headaches might develop within 3 days of the stroke but are not always sudden. On the other hand, a hemorrhagic stroke results from a burst blood vessel causing bleeding in or around the brain. The headache here is very different. It often comes on suddenly and is described as the worst headache of your life. People say it feels like a thunderclap, sharp, intense, and reaching maximum strength within seconds. This type of headache can be in the back of the head or all over. It is usually accompanied by other serious symptoms like weakness on one side, difficulty speaking, vision problems, dizziness, or even loss of consciousness. Sometimes, before a major bleed, there can be warning signs like a less severe headache with neck stiffness or eye pain, especially if an aneurysm is leaking. Knowing the difference between these headaches is important. Stroke-related headaches often come with neurological signs like numbness, weakness, or trouble talking. Migraines can cause nausea or sensitivity to light but usually follow a pattern of recurring episodes. If you notice a headache that hits suddenly and is extremely intense, especially with other symptoms like weakness or speech trouble, it is a medical emergency. Call emergency services immediately. Quick action can make a big difference in treatment and recovery. Remember, if you or someone else experiences a sudden, severe headache with neurological symptoms, do not wait. Seek emergency medical help right away. Recognizing these warning signs can save lives and prevent long-term damage.